All right, thank you very much. New questions coming in overnight about the information used by AstraZeneca for its U.S. trial of its coronavirus vaccine.
Yeah, the National Institute for Allergy and Infectious Diseases says it's concerned that AstraZeneca used outdated information, they say, when it reported results from its human trials on Monday. So this morning, Dr. Dana Hawkinson from the University of Kansas Health System joins us live to talk more about this. Dr. AstraZeneca says that an independent review found the vaccine to be 79% effective against symptomatic coronavirus, 100% effective against severe cases that would put you in the hospital. We talked about this yesterday on the morning call. You guys talked about the AstraZeneca trial quite a bit and what could be coming. How is the medical community seeing this news this morning? Is it a hiccup? Is it a, oh, this could mean bad things? What are you looking at this morning when you hear about this kind of change?
Yeah, I mean, I think we were certainly encouraged yesterday by that information. This morning, I think it'll be a little bit different. You know, AstraZeneca was one of the companies that first started their human trials, and we were excited about that. It seems like they have had these hiccups, if you will. You know, I think they were part of the first vaccine group that had some adverse events that they had to pause the trial for and then look at. Then we hear about the blood clots issue, and then maybe it's not so good for older people, so I think some of the countries suspended using that vaccine in those groups. And now we have this. From what I understand from the news reports is that they really should have been working with that agency to be able to put out press releases like this. Just as you said, an independent review found that they had those results. So I think it go one of two ways. One, they could come back and say with the U.S. government agencies, yeah, it really does look good. I think we'll go ahead and do this. Or this is truly inaccurate data, so we need to go back to the drawing board or reevaluate or continue trials for some reason.
Wow.
Wow.
Doctor, we want to talk a little bit about potential side effects to the vaccines. Now, we know we've heard experts say some reactions to the vaccine are expected, should not discourage people from getting vaccinated. Can you help us differentiate what side effects could be from the shot, or if you happen to be feeling ill after the shot, could that be from something else entirely? What are the different symptoms you're seeing?
Yeah, I mean, I think first of all, identify the time period. Did you just get the vaccine 12 hours, 24 hours ago, you know, 36 hours ago? What kind of symptoms are you having? Because if the symptoms arise around that time, during that time, it certainly could be related to the vaccine. And these are things like a little bit of fever, chills, maybe not feeling so good, fatigued, headache. We heard yesterday on the call as well, we had Dr. Pahood from Children's Mercy, and what she was saying is that, yeah, I mean, you aren't going to have the cough and cold symptoms of the runny nose and the cough. That could certainly be allergies. That could be the infection. COVID-19, it could be another infection as well. And so I think it really boils down to, number one, looking at the timing of the symptoms compared to the vaccine, but also what are the exact symptoms, because certainly some are more prevalent than others. We know that if you start losing your taste of smell, your sense of taste or your sense of smell, that's not going to be the vaccine. That is probably going to be the infection. So I think it just boils down to, again, timing and what exactly the symptoms are.
Our friends at the Today Show talked to a group of doctors, actually two of them, who told them they're seeing three groups seeing side effects to the vaccine more than maybe everyone else. And they identified women, young people, and people who have already had COVID. Is that something you're hearing about as well? And would you see any particular reason for those groups to be the ones that they're seeing those in?
No, you know, certainly for women, I do understand from some of the V-Safe or the VAERS data, and those are both separate types of monitoring for adverse events after the vaccine. V-Safe is specifically for COVID-19, again, put out by the CDC and its groups. I think a larger proportion of those people reporting are women, but other than that, don't understand any of the other demographics. Could certainly be true. We would understand that if you did have COVID and you got a first dose of vaccine, is that really acting like a booster dose? So certainly you could have some exaggerated symptoms on that. But I've also seen people who have had it, who did have, you know, some more symptoms after that first dose of vaccine. So we're really hesitant to get the second dose, but ended up getting the second dose and didn't have any symptoms whatsoever. So I think there is so much heterogeneity there, so much differences and variability from one person to another.
Quickly before you go, did you have worse symptoms from either of your 2 shots, the first or the second?
I can't remember. I think the first one was a little bit worse, just as far as a little bit more fatigue.
Okay.
From the soreness, definitely my shoulder was more sore after the first one, surprisingly, compared to the second one.
Interesting. I know we're just learning so much as this
Every day.
It's all new. Dr. Hawkinson, thank you so much. Thanks for joining us.
Yeah.
And you know, Dr. Hawkinson joins us live
All right.
every Tuesday here on 41 Action News Today. We're so grateful for that. And this morning, he, along with KDHE Secretary Dr. Lee Norman, will be on the University of Kansas Hospital System Daily Briefing to talk about the vaccine rollout in Kansas. You can watch that on our Facebook page, streaming live at 8 a.m. We'll be right back.